And everybody leaves that first briefing with an idea of what's going to be the actions going forward and what we can each do to support one another. One of the things that I would say our community can take great pride in is that all the agencies on island work very well together. There are no jurisdictional issues as far as state versus county versus federal, private. Everybody's working together. Everybody's in support of one another. It's a tremendous team effort. Another thing we do is provide a conduit for requesting additional assistance. As we're managing some of these events, if any agency is running out of resources or that event is exceeding their capabilities and capacity, our goal is to try, or one of our roles is to try and provide them with access to additional resources. We're able to do that by reaching up to our state partners at state emergency management or state civil defense, and if need be, up to the federal level. So in this case, an example of the partnership and building capacity, as the Department of Health sees an increase in a number of cases, and one of the mitigating strategies or strategies we're trying to get controlled is treating the mosquito population. As we try to understand and identify the locations of the mosquito breeding grounds, and in some areas around the confirmed cases of the dengue virus, one of the actions is to treat those areas by spraying them with an insecticide. And again, as these cases increase in numbers, we'll need to build more capacity to respond and treat areas. So through the partnership with Department of Health, we trained up county Parks and Rec and Public Works staff to supplement the Department of Health team and work together. But that's just an example of how we work together to build capacity, marrying up resources from county and state and other agencies to meet the needs of the incident if it continues to grow. And again, I cannot stress how significant and how important it is that we're all working together in the interests of your safety, and how important a role you're going to play. You're going to hear from the Department of Health when they come up here, the science and health behind this particular issue, and what you can do to help control the mosquitoes and prevent an exposure or prevent yourself from becoming infected, and then this issue just continuing through our community. As of 10 o'clock this morning, we have 56 confirmed cases. That number has increased by this afternoon slightly. And again, of that, we know that 46 of this morning were residents, 10 were visitors, and it's across multiple areas of this island. There are some areas on the island that are seen as hotspots, or areas of common interest in some of the cases. And again, our Department of Health partners will share that with you. So without further ado, I'd like to welcome up the Director for the Department of Health, Dr. Virginia Pressler. It's a very serious situation, so obviously she's here to address you, and we're just glad that we have her on island and her support, and look forward to working closely with her. So again, thank you for being here tonight, and we hopefully will have you leaving with information to your questions. Thank you.
Thank you, Chief Oliveira, and aloha. My name is Dr. Jenny Pressler. I'm the Director of Health for the state of Hawaii. And even though I hail from Honolulu, I grew up on Maui, and all of my family actually lives here on Hawaii Island. I've got 4 siblings, nieces, nephews, grandnieces, grandnephews, and they're pretty much all over the island. So I have a personal vested interest in this, as well as the public health interest. And our mission at the Department of Health, of course, is to protect your health and safety. So as Chief Oliveira said, he's the unified command, and we're here to work together with Chief Oliveira and the mayor and all of you in order to help get the right information out so that you know how to protect yourselves and your families from dengue fever. So we have put together a number of materials, and Jason's going to go over those with you in just a moment and share with you a little bit about the disease. I think Chief Oliveira gave you some numbers already. Those numbers will probably continue to increase for a while because in addition to the 56 confirmed cases, we have 30 suspect cases where we're already sending teams out to evaluate the areas that are being tested, and so those are in the pipeline. Now we have as many negative cases as we've had positive cases to date, so not everyone that's a suspect case will turn out to actually be positive for dengue fever. But we just want to assure you that we are all working together, and Jason, I'm going to let you come up and explain to everyone a little bit more about dengue fever. I'll be around for questions.
All
right, thank you very much. Aloha. So tonight's goals, we got a couple goals tonight. Number one, we want to tell you what dengue is. We want to tell you what the symptoms are, what to do if you get sick. We want to tell you what the Department of Health is doing is in a little bit more detail. And of course, the last thing we want to do is communicate to you about our Fight the Bite campaign and how you guys can help us, on this task as well. So what I've found very helpful in starting off these conversations is by asking actually you guys a couple questions. So I'm going to ask a question, raise your hand. How many of us have either been born abroad or have lived abroad for a significant part of your life? How many of you have traveled internationally at any time? How many of you have traveled outside of state recently? How about any time? Most of us. And of course, that includes neighbor islands too. And how many of you can remember in the last 2 weeks where you have been, what you've been doing, who you visited on an island or either off island? So just think about that question. We're going to get back to those. But the reason why I asked you that first question about that international question is that dengue fever, 40% of the global population is at risk for dengue fever, 40%. The World Health Organization estimates that there's probably around 50 million to 100 million cases of dengue fever worldwide. I know that's a pretty large spread, but that's probably because a lot of that goes unreported. So it's an estimate. The good news is, of that big number, only about 22,000 people die. So by and far, there is not a lot of death associated with dengue fever. It's a possibility. Those that show symptoms could go on to express a different version of the disease that is much more complicated called dengue hemorrhagic fever. However, only about maybe 3% of those cases will move on. So the chance of fatality for dengue fever, quite low. But the reason why I also asked you why you traveled, dengue fever is endemic in 100 countries around the world. It's not endemic here. And that's certainly one task that we're trying to make sure doesn't happen. And so dengue fever itself. So dengue fever is a mosquito-borne disease. That means it's transferred between people via the mosquito. Technically, the mosquito has to bite someone that is infected, that person, okay? Mosquito bites the infected person, goes off. The next meal, if it bites another uninfected person, that person could get dengue. After you get bit by one of these mosquitoes, you could show symptoms within 5 to 7 days. However, that range could be 3 to 10 days. But usually about in a week, you'll start showing symptoms. The symptoms of dengue include sudden onset of fever, headache, retroorbital pain, kind of really deep headache, can you feel behind your eyeballs? And sometimes, and then you may also show a rash, primarily on your forearms, but also on your legs. And a lot of this sounds kind of flu-like, yeah? And sometimes, you may hear it saying, well, if you have dengue fever, it might actually be flu-like. But that's not entirely fair. The flu actually is a respiratory disease. It comes with respiratory illness, so you'll have sniffly noses, congestion and whatnot. If you're exhibiting that, you might have the flu. However, there is parts of chance with chances of comorbidity too. So you want to be careful nonetheless. So as I said, it's mosquitoes, right? Remember, the disease itself cannot be transported between person to person. It needs that mosquito to bite an infected person and to bring it on, bring it to another person. So the idea is, well, how did it get here, right? One reason why is that dengue fever is on the rise. In fact, in the last 50 years, the number of cases worldwide has increased about 30 times. 2 reasons why. Urbanization, people moving into larger and larger cities, and number 2, travel. So it's no surprise that someone, either a resident of Hawaii or a traveler coming into our state, could have brought it from somewhere else. They bring it in, they may not know they have it yet, your symptoms may not be showing, and you have to have symptoms in order for you to pass it on too. That's an important part. If you're not showing symptoms and a mosquito bites you, that mosquito will probably not be infected by dengue itself. So you have to be showing symptoms. Mosquito bites you. It takes a few days for that, the virus itself in the mosquito to amplify, but maybe that same range, about a week. That mosquito is now infected. Then it will go bite another human and pass on. Now, certainly, mosquitoes live in other areas where there's all kinds of animals that they feed on. Chickens, birds, cows. None of those other organisms carry dengue fever. So, like I said, it's that human-mosquito-human cycle. And so in many ways, that's what we kind of expect to happen here. So if you have dengue fever, what we're recommending you to do, or if you suspect that you have dengue fever, is to, number one, go to your doctor. They can assess what the situation is, do some basic travel history or basic, background information on you to determine if you fit that possible case definition. Some lab work will be ordered, and we have capabilities within the state that can actually confirm that. So that'll be done. But we do recommend everyone getting to their doctor as soon as possible. If you have trouble getting in, you can also go to the ER. Wouldn't recommend that, but you can also go to urgent care, and they can do that as well. If for any reason that's not possible as well, contact the Department of Health. We can certainly work on a case-by-case basis to try to get those labs ordered for you, if that's an obstacle. We want people to let us know. That's the only way we're going to kind of get on top of the ball and behind this thing. We need to know if people are out there. We need to know what their situation is and how we can help. So, of course, like I said, if you think you have it, see your doctor. The treatment for dengue fever is actually, what our clinical guidance is actually really just Tylenol, acetaminophen. Your immune system itself should help you out. Within 1 to 2 weeks, most of us will actually, our immune system will respond, and you'll no longer be sick, and you'll no longer be symptomatic as well. But it is an issue, because there are 4 types of dengue: type 1, type 2, type 3, and type 4. If you have lived abroad and you've had dengue fever before, or if you've gotten it here, even if I would live here and I got it, type 1, I can't get type 1 again. However, you are still susceptible to the other types of dengue: type 2, type 3, and type 4. For this particular incident, we don't suspect that it's more than one particular type. However, we are kind of concerned, because there is a chance that if you've actually had a previous type of dengue, if I had type 1 and I was particularly infected by another type, type 2, type 3, or type 4, your risk for complications goes up about 15 to 20%. So that reinfection, so if you have family relatives that may have had dengue fever before and they're not sure what type they had, it's something to be a little bit more concerned about. And so, like I said, number one, go to your doctor. If not, approach us. We'll try to work with it on a case-by-case basis, but we want people to come forward. Let's see. Okay, moving on. We want to talk about what Department of Health has been doing. So let me establish a timeline and how we actually work backwards in these cases. So in any kind of outbreak investigation, we're working kind of behind, right? We already have the exposure. We already have the outcome. So it was reported to us in about mid-October that someone could have a possible dengue infection. So mid-October, we find out. Remember that question I asked you in the beginning? Could you tell me where you've been in the past 2 weeks? Pretty much, if you went up to visit someone there, were you camping somewhere and whatnot? So we get that rich information from that individual. And as more kind of suspected cases emerge, we do the same thing. We kind of work backwards. And our estimates, most of, the farthest we can go right now is probably that mid-September is when we suspect that first case was first introduced. However, our investigation, we really didn't start until that mid-October, and we're working backwards to kind of figure out where people were. What have they been doing? Who have they been visiting? What parts of the island? And so there was a map released, and it's on our website, healthhawaii.gov. That map has been updated as of November 12th. And I believe the case count is less than what we've shared today, less than that 56, but it still gives you a good idea that dengue fever, we're investigating across the whole island. There's not, there certainly is hot spots, but there's not one community, with the larger populations on this island that are not affected. So this is something that, we certainly all want to be, heightened awareness about. And so the Department of Health does a few things in these investigations. So we do that background information for the person. First thing, when it's a suspected case, our environmental health team, goes to where the person works, where the person lives, where, any other locations that could have been suspect. Within that area, the idea is that there is a 200-yard radius with which the mosquitoes we're dealing with can fly. So we canvass that area, 200 yards around that area. We go to businesses and whatnot. Go to each residence and ask them, can we check out your yard? Do you mind checking us out? Here's some information about dengue fever. We're trying to stop the breeding areas where these mosquitoes can grow. Secondly, our vector teams are mobilized to go to either the residents or the work. And they seek consent from where there's the business place or the residents, and spray within 25 yards. Hopefully, and they spray with an adulticide. That the one that we use is called Aquareslin. We can share the MSDS with you if you'd like. But it is an adulticide, and and it is something that's regulated and can only be used by government entities. So this is not available to the public. You actually need to have a respirator in order to operate it. So it's pretty heavy stuff, but it's still a little bit more mild on the toxic of all the toxic adulticides we can do. So as I said, kind of spray around that area, do a larger area because the mosquitoes themselves, 200 yards out. The two mosquitoes we're dealing with here, Aedes aegypti, Aedes albopictus, both can carry dengue fever, but also can carry other mosquito-borne diseases. Aedes aegypti actually is a little bit more active during the day, likes to come in, kind of bite your ankles and whatnot, but they're also active early morning and late as well. The other mosquito, also active, nighttime or early dawn, late afternoon, but also will is more active to bite you at night. What's interesting about the Aedes aegypti is if we turn a light on, like in here, they'll come in. They'll think it's nothing to do with the daytime. They're just looking for light, so they will bite you as well. So those are the two mosquitoes that we're particularly worried about. There's other mosquitoes on this island, of course, but those are the two ones that can carry dengue fever. And obviously, any kind of treatment we do, any kind of prevention to prevent mosquitoes can also prevent all these other mosquito-borne diseases. So it's very important for us to all work together. And so that's what the Department of Health is doing. Now, all of you have a responsibility too, and this is where you can help. So we've created this campaign. It's called Fight the Bite. If you don't have the flyer, they're on the desk behind you. Also available at our website, health.hawaii.gov. I'll kind of read through here and give you a little kind of idea of what this is on here as well. So the first thing is to eliminate standing water in buckets, puddles, etc. The idea is that if we can stop the mosquitoes from reproducing, there's less chance of them passing it on. So, that's old tires especially. Any reservoirs for water, kids' toys, whatnot. Fix leaky faucets and outdoor hoses that are dripping water. Just a little bit of water is all mosquitoes need in order to lay their eggs. And the eggs themselves are pretty hardy. They can, survive even in a little bit of water. So any kind of water is too much. Try to do that. Treat bromeliads and other plants that hold water. Bromeliads are kind of those big ones with the little holes and the water collects on the inside, kind of a little reservoir in there. So the idea is that, that's another place where the mosquitoes can breed. One thing that we've actually discovered is you make a solution about 4 ounces to 6 ounces of soap, dish soap, to 1 gallon of water. You can spray that on your plants. What it does is it creates kind of like a film on it. And the mosquitoes can't lay their eggs on it. You can also use this in standing water. And for some reason, our vector team has kind of been experimenting, and we've heard from other groups as well. Dawn soap works the best. Dawn soap. I think it's just something about the resin or the concentration of it that actually just sticks a lot better than other things. So I'm not trying to plug any particular dishwashing detergent, but if you have Dawn, you're already there. Clean your gutters so water runs freely. This is something we should probably just do. This is just regular maintenance. Repair screens and jealousy windows to keep mosquitoes out. That's kind of a given. I myself have kind of open doors and not the perfect tight-fitting screens as well. So it's something that I want to keep ahead of, or certainly not keep them open during the early morning and that late afternoon, evening when they're more active. And specifically dispose of old tires. As you've probably been hearing on Daryl's civil defense messages, is that the county is accepting tires at most transfer stations without fees for you. So this is your time to take advantage of that if you've been kind of hoarding tires. Of course, protect yourself when you're out. So apply insect repellent when you're outdoors. Always follow directions for using repellents, especially on small children. We recommend using DEET, D-E-E-T, 20 to 30% range. However, DEET products come in all sorts of ranges. The best advice we can give you is, use something that you're comfortable with. If one of those aren't particularly working, citrus eucalyptus oil is another one that even is just as effective as some of the DEET products itself. So the best thing to do is experiment with what you have. If the mosquitoes are still biting you, you might want to increase the DEET. You might want to try a different product. There's a lot of things for you to use, but we're recommending things that have at least a scientific background to guide you. Clothing such as long pants, long sleeve shirts, and socks can help protect from bites. Obviously, you want to create a barrier between you and them so they can't even bite you. That stuff you spray should actually only be on exposed skin. The repellent only goes on exposed skin or the clothes itself, but you don't have to spray on your skin if it's covered. So, like I said, I don't think any of us really want to spray, continuously, but, it's just the nature of it, indeed. I should also point out that make sure you read the labels on there, especially if you want to use it for your kids. They don't recommend this citrus eucalyptus oil should not be used, I believe, in kids under the age of 3. And no DEET should be used, I believe, in children younger than 2 or 3 months. So make sure you read the labels to see what's appropriate and what you're comfortable with. And of course, avoid activities in areas with lots of mosquitoes and going outdoors at dawn and dusk when mosquitoes are most active. Remember, this disease is being spread by the mosquitoes and we're helping them. So if we give them a chance to bite us, and they do, and then we travel, that's how it's getting around the island. Mosquitoes can't fly, as I've mentioned. These particular mosquitoes can't fly more than 200 yards. So if there were these mosquitoes, in our hot spot, of course, from our investigation is pointing at Ho'okena area, these mosquitoes did not fly all the way to the other parts of the island. They're being transported by other humans who possibly got infected. And the most interesting thing, I've said dengue fever itself is not, particularly doesn't have a high fatality rate. And but the interesting is a lot of people who actually get infected actually are asymptomatic and don't know they're carriers. So you may actually have actually been subjected to dengue prior, but you don't know it. So most of all, and a lot of these diseases, the mosquito-borne disease, you don't know that you actually have got it. The large people who get infected are asymptomatic. So if you recognize your symptoms, once again, we recommend going to the doctor. If you want more information on dengue fever, you may call 211. This is the Aloha United Way number if it's for just general information. Any concerns that you may have if you think you have it and you can't get to a doctor, call the Department of Health. We'll help kind of triage you out through that. Any questions about large pools of water, what to do about particular infestations? Our idea is that we're not spraying indiscriminately wherever we think mosquitoes are. Just because you may have mosquitoes, there's no evidence that those mosquitoes may actually have dengue. So we're only spraying at suspected and confirmed cases, And there's other measures that you can take. We've approached a couple of companies on island that can help individuals, residences, if they have a mosquito problem and want to come out, come see me afterwards. I can share that information. That's about it for our presentation, right? We can open it up for questions. We got the whole panel here can give you a couple of things as well. So we're going to have the cards? Yeah. So we're going to put out some cards. Just raise your hand and we'll try to get those out to you.